Where are they getting the COVID from? Can you tell me is it the parties? Is it the workplace? What are the main places that they are bringing it from?
They're getting it from social activities, social events like parties, like clubs. They're getting it from weddings. They're getting it from funerals. They're getting it from the workplace. And it's easy to tell, when they come to us sick, we take a history, and the history comes out very, very clearly. They'll tell you they went to this function. Somebody they were sitting with at a table has since tested positive and has called them to let them know. They come to test usually for reasons like that. So they tell that they were at a funeral and the people that they were with, now they hear that, so-and-so has got it, so-and-so has got it. And they come because of that. So when they come to you, sometimes they know that, they know exactly where they got it from. Other times they come, like I said, they come with symptoms. Bernard, it's really funny, because you listen to them, you get their history or you get their symptoms and everything. And you suggest, you know what, we've done so-and-so test. I think you should do a COVID test. oh, how? Me? Oh, how? I mean, they almost sound as if you're accusing them of having some unmentionable, disease. So the other thing that comes out a lot in the history is, by the time they come to you, they've taken every single medicine in the book.
They're already treating themselves.
Medicine. Bernard, they've taken, they talk to their friends who've had COVID before. By the time they come to you, they've taken azithromycin. Of course, everybody's taking the zinc and,
vitamin C.
And the vitamin C. Bernard, you see, there are 3 stages of COVID. I must make this very, very clear.
Mm-hmm.
There are 3 stages of COVID. So the first is, asymptomatic and mild. Then you've got the moderate, and then you've got the severe.
Mm-hmm.
And the treatment for each stage is different.
Okay.
So the treatment for asymptomatic, mild, as soon as you start getting to moderately severe to severe, the treatment completely changes. Okay. And an important tool we have in the management of COVID is a pulse oximeter, which certainly all high-risk patients should have, because this tells us very clearly if they're monitoring themselves at home. You can tell when one is moving from one stage to the next, you see. And there is no place for the treatment of severe COVID in the home. By that stage, you should be in the hospital. So when you hear that, somebody has got COVID and he can't breathe, and he's at home and he's taking oxygen. And by the way, people are buying oxygen tanks. People have oxygen in their homes.
At home?
Yes, Bernard. Yes. And it's actually dangerous to treat a severe case of COVID in the house. So you get a mild case of COVID coming into your clinic, and they've already put themselves on drugs like steroids, which are meant for severe cases. You take it in the mild or asymptomatic stage. And what it does is that it suppresses your immune system, and you're more likely to progress from mild to severe, you see.
So self-medication can actually kill you?
Self-medication can actually make your situation worse. It can actually kill you, because drugs like azithromycin are prescription drugs. Not everybody can take it. If you have certain heart conditions and you take azithromycin, it can give you a dangerous rhythm of your heart. And in fact, it can kill you suddenly, you see. Yes, but by the time they've come, and the doses, they don't know the doses. And somebody says, I took it for 6 days. Somebody says, I took mine for 7 days. Or somebody says, I took it for 5 days. It didn't get better, so I repeated it, And these are some of the problems we have with managing COVID.
Okay.
Everybody is reading a lot, and some people are just doing the wrong thing,
Okay.